Hey, welcome to the video. I'd like to spend a few minutes talking about how we can treat snoring, fatigue, and sleep apnea without the need for CPAP or surgery with a simple, non-invasive, custom-fit dental appliance using our easy 3-step Refresh Sleep method. First, I'm going to tell you who this treatment plan is not for. This is not for people who do not value their overall health or their overall sleep quality. People who perceive they don't have a problem and don't care about the impact that poor sleep has on their quality of life. People who are morbidly obese, have uncontrolled cavities, or extensive dental treatment needs, the dental device may not be a good fit for you. Of course, if you're not sure, we would evaluate any of these physical limitations before ever starting treatment. Now, most importantly, we do not want to work with people who are not committed to bettering their health and overall sleep quality. I am committed to you 100% if you want to make the investment in your health and well-being, but we cannot help you if you do not want to help yourself. If you are someone who is not ready to make the journey towards better health and better sleep, then I'm going to invite you to leave now. Let's talk about who this treatment plan is for. If you've already been diagnosed with mild or moderate sleep apnea, the dental device are a great first-line treatment and an excellent alternative to CPAP. If you have more severe sleep apnea, then this can still be a great option for you if you are unable or unwilling to use your CPAP machine. Dental devices are an effective, non-surgical treatment option for anyone struggling with CPAP. And if you are someone who wants to work collaboratively with your existing medical care team in order to enhance your overall care and health outcomes, then my office is a great fit. Most importantly, this is for you. Someone who wants lasting, long-term results for their overall sleep quality and long-term health. So my big promise to you for watching this video is I will show you exactly how to fix your snoring and sleep apnea in order to maximize your sleep quality and help you avoid chronic disease in order to live a longer and healthier life. Now just imagine for a moment waking up and feeling like you actually got the rest you needed to feel ready to face the day. Or being able to sleep next to your partner without constantly disrupting their sleep because you're snoring so loud or tossing and turning to find a comfortable spot in order to breathe. Imagine how good your partner will feel getting a full night's rest because you did. I can help you create an environment where you could sleep next to each other uninterrupted and where you both can wake up feeling great and resentment-free. Or consider the mental clarity needed to focus on your daily tasks that you get from a full night's rest. There's no feelings of being in a constant state of brain fog. Just picture yourself waking up with actual energy, ready to get out of bed without feeling constantly exhausted all day, every day. Imagine if you had a way to take control of your nights so you could actually start to own your day and take back the life that poor sleep has stolen from you. Let me take a moment to show you a few of my patients who've had some amazing outcomes from dental appliances. This is Doug. He was waking up exhausted every day. His partner was complaining of snoring, and he felt like he had no energy to play with his daughter. As a result of treatment, he feels like he's living life more fully and is able to be more present for his family. Because he wakes feeling more rested, he's had the energy to lose 22 pounds in 6 months. Heidi came to us at the recommendation of her dentist. She was unable to get insurance coverage in spite of her sleep apnea diagnosis, but she still chose to invest in her health. She was impressed with the simplicity of the entire process from start to finish. The appliance was comfortable to wear and easy to adapt to. Prior to therapy, she was waking every 2 to 3 hours. Now she's sleeping through the night, which she hasn't done in years. She felt great results on the very first night of using her appliance, and no adjustments were needed. Jessica was struggling to get used to her CPAP and was waking up every 2 hours to use the restroom. After starting treatment with a dental device, we did a follow-up sleep study, and it showed that her appliance has completely eliminated her sleep apnea, and she has since been able to return her CPAP machine. Now she's sleeping through the night silently next to her partner and waking up feeling more alert and focused. Now Rick is 76 years old, and he's worn an appliance for 10 years. His existing appliance wasn't fitting well, so his sleep apnea wasn't being effectively treated. He likes to routinely go on mission trips where there's no power for his CPAP, but he was too scared to travel with nothing. So my staff simplified the process to treatment and made it easy for him to restart therapy. We optimized his existing care plan, and now he has an appliance, is waking up with more zest, and feels like now if he naps, it's because he wants to, not because he has to. He's back out traveling to all the remote corners of the globe and is just thrilled with his outcomes. Now, there is no shortage of people we've helped break free from snoring. We've helped so many individuals just like you find an alternative to CPAP and get more restful sleep. They now sleep healthier and wake up feeling each day vibrant with more vitality in their life. And each of these people were just like you. How do they do it? Well, I want to show you how all of our patients were able to get these amazing outcomes. My office can provide a simple, mask-free, noise-free, cord-free solution for snoring and apnea management. And this is customized to your specific body and sleeping pattern. We will work collaboratively with your existing medical care team to provide individualized care, one-on-one time throughout the entire process. We can even provide sleep testing that's done in your own bed in order to diagnose the problem and help ensure great results. If something doesn't add up, we're there with you. If you're having any kind of issues, we're there with you. We're not like the big CPAP suppliers that give a one-size-fits-all cookie-cutter assembly line care. We're not like the big CPAP suppliers that give you a one-size-fits-all cookie-cutter assembly line care with no support along the way. I'm going to show you exactly how this works, but first, let me tell you a little bit about myself. I'm Dr. Brenna McLean, a second-generation dentist from Northern Arizona. I'm passionate about providing tailor-made and innovative sleep solutions that give my patients an avenue towards better health and increased vitality. While most other dentists practice as a jack of all trades but master of none, my practice is exclusively focused on enhancing and transforming your sleep through dental appliance therapy. I've chosen to forgo providing other dental services and be the master of my craft so that I can be laser focused on providing exceptional outcomes in one arena. I love watching my patients have phenomenal results and seeing how a good night's rest can be truly life-changing. I've seen how sleep apnea impacts people across all ages, races, shapes, and sizes, from helping our service members inside the Pentagon all the way to my own bed, where my husband and I have both achieved better night's rest thanks to dental appliances. Now let's dive in and talk about how this process works for you. First, we're going to analyze what's really going on with your sleep and your health. Once we start therapy, we'll customize the appliance based on your unique needs. Most importantly, we'll follow up in order to improve outcomes and get better results. These are the 3 steps we'll walk through together. Step 1, analyze. So let's take a closer look. One of the things my patients often complain about is the process of actually getting diagnosed with sleep apnea. Using the current national insurance model, access to care across the entire healthcare system is incredibly lengthy. Days to weeks to months and possibly even years in some cases. Delays are so long, people often get frustrated and tend to want to give up before ever getting started. If you have to go into a sleep lab for a diagnostic test, that environment can be foreign and extremely unnatural to what you're used to. If you can't actually fall asleep during a sleep study, this will cause the test results to be skewed negatively. Because think, if you're awake all night, you're sure to be breathing. Plus, how could you sleep well if you have wires all over your body? You're in a lab, in a place that you've never slept before. Additionally, testing in a lab can be quite costly and may be overkill for what you need. If I had to go through this, I probably wouldn't want to get a sleep apnea test or get diagnosed either. For most people, the process takes too long, is too uncomfortable, and too costly. And it's natural to want to avoid this situation altogether. You end up feeling resigned. And then you just continue existing in the same unhealthy state you've always been. So how do we at Refresh fix this problem? The faster and easier we can make the diagnosis and get you into a dental device, the better for you. What is the solution? We have multiple ways to coordinate streamlined and simple home sleep apnea tests that's done in the comfort of your own bed. Oftentimes, we can get you tested and diagnosed in less than a month, if not sooner. What we're going to do is a simple home test like I'm showing you here. We'll analyze what's happening in your body, and then a medical doctor will look at your data and confirm the results to establish a diagnosis. The old way is slow, cumbersome, and expensive. Now we can complete the process simply in the comfort of your own bed and still have a clear understanding of the extent of your sleep breathing issues. And best of all, it's convenient for you and your lifestyle. Now let's talk about how we customize your care plan. Many people often complain that the CPAP masks don't fit well. The hoses are claustrophobic and restrictive, and the machine is so noisy that a quiet night's sleep is always just a little too far out of reach. Adding to the problem, the machines are often provided by big equipment supply companies that have too many customers and not enough inventory to go around, which could mean months of delays in getting the machine to begin with, or the replacement parts down the line should you ever need them. The suppliers are often overwhelmed and don't want to spend time helping people be successful with their machines, so you're set up for failure right out of the gate. Plus, when it comes to CPAP, more than one person has told me that they feel like Bane when they're wearing it. So what's next? You need life-improving treatment for your sleep apnea. You can't tolerate the machine for one reason or another. The supplier won't help. It'll be months before you get an appointment with your doctor. In the end, you're left with a huge deal of frustration about your outcomes. Or let's say you are able to tolerate your machine somewhat. Oftentimes people will still complain that there's sleep disruption caused by the claustrophobia from the cords and the hoses. So if CPAP is not working for you, then the chronic fatigue persists. So much so, I have treated patients literally falling asleep in my chair mid-sentence because they are just that tired. Ultimately, they end up feeling hopeless. Hopeless. Nowhere to turn, no one to help you navigate your treatment. Sleep really shouldn't feel so exhausting, but without treatment for your sleep apnea, your sleep quality and health cannot improve and the situation remains. So how can we fix this? We provide a unique built-for-you solution in the form of a streamlined, specialized dental appliance worn during sleep. The dental appliance is cord-free, mask-free, noise-free, and fits exactly to your unique body. It's just like finding a well-fitting shoe. Because there's nothing attached to the outside of your face, you're free to sleep and move in any position that is comfortable for you. With less disruption throughout the night, that can really kick open a door to a quiet night and a much more energetic day. I want to spend just a moment talking about how this treatment actually works. In normal breathing, you have a clear path from your nose to your lungs for air to pass freely. During sleep, however, your jaw and muscles relax, which can cause the tongue and soft palate to fall backwards and block the airway, which causes snoring and apnea, aka pauses in breathing during sleep. Sleep apnea is scary because the persistent breathing disruption is linked to multiple other chronic medical conditions like high blood pressure, AFib, heart attack, stroke, Alzheimer's, dementia, diabetes, impotence, chronic pain, and weight gain, to name a few. Now, as you probably know, CPAP works by forcing air into the airway system, shoving the airway open, kind of like blowing up a balloon. The dental appliance works by attaching to the teeth and preventing the jaw from falling backwards or gently pulling the jaw forward. It provides support, and in effect, it pulls the tongue out of the way, which prevents and minimizes the blockage to create more space for better breathing. Better breathing equals better sleeping, which ultimately leads to a healthier life. With the old way, patients are stuck using an awkward, disruptive cookie-cutter CPAP machine, and they're left with little to no support from the equipment suppliers, so many people never actually get the treatment they need. With the new way, we can provide a sleek, maskless device that's customized exactly to your body, chosen based on your specific needs, and will walk the path from day 1 to day 1,000,000 with you the whole way through. The process of getting a well-fitting dental appliance is truly effortless. Walking the path together is how we successfully optimize your appliance and treatment outcomes by providing individualized follow-up care for long-term results. That's the third step in our process. Like we talked about, CPAP suppliers tend to provide equipment and little to no other long-term support to help with machine issues and resupply problems. If you cannot wear your mask, your sleep apnea is not being treated, but the condition remains and is impacting you every single night. It is currently estimated only about 50% of people are tolerant of CPAP therapy, and I think a big part of that is from lack of support from the suppliers. If you can't get help with equipment problems, replacement parts, recommendations for side effect management, then the likelihood that you're going to be successful with therapy goes down and the outcomes are not as great. If you feel that CPAP therapy is just not working for you, then your sleep apnea continues to progress and you lose out on better sleep, more energy, and a healthier life. We see a lot of people that feel resigned and stuck in the treatment process. A lot of time is spent and wasted. Patients and their partners are discouraged, and overall they feel helpless. In spite of all the time and effort spent on getting better, they are still exhausted with the process, with their treatment outcomes, and generally in trying to live their daily lives. So how can we help fix this? By providing appropriate follow-up and follow-through during the entire course of your treatment. We will guide you through the entire care process from start to finish to help create lasting results. We want to make sure we provide a collaborative approach to care with your existing medical provider team so that everyone is on the same page as far as your care plan is concerned. We'll provide open communication to you and your doctors during the entire treatment process. And really, treatment is not complete the day you take your device home. With appropriate follow-up, we can improve your tolerance to therapy. Upwards of 90% of my patients can wear their appliances all night, every night. Ultimately, we want to optimize your sleep quality and provide more successful outcomes. We'll make the process easy and simple for you to go through so that you can succeed. The old way promotes a broken healthcare system that isn't designed to help care for patients comprehensively or for the long term. The more we can work with you and your existing care team in a collaborative and comprehensive approach, the better we can advocate for you and your overall health to ensure long-term success so you can ultimately start to feel more refreshed, both during your sleeping and your waking life. Now, this process is meant to work together in tandem, not in silos. You need all three for the best results and long-term successful sleep to happen. Simply put, this is the refreshed sleep method. Now you have a choice. I've given you the information on how you can have an alternative path outside of the standard CPAP route in order to start getting the refreshing sleep you deserve. And you have two choices in front of you, because if you're here with me right now, you probably aren't someone who does nothing. You're looking for a solution to a problem, and here are your options. Option one, you can go at it the old way, having to deal with the broken system that is not designed to help you get results. The old way, subjecting you to horrible sleep for both you and your partner. You're stuck in a vicious cycle of thinking you're sleeping enough at night, but it just never feels like enough. Or option two, we can work through a medically proven process with my team that actually advocates for you and your health. This way you can get restful and refreshing sleep so that you can actually get rid of the brain fog, stop disturbing your partner, and start to feel like you can get the sleep you deserve. After everything you've heard, I've decided to set aside about 8 hours this week for my team and I to speak with you on how we can help. Through the process of discovery, we'll get clarity on where you're at in the process starting from scratch. We want to know if you're brand new to sleep apnea, or if you've done this before, where you're at in the process, and what roadblocks you've already faced. This way, we can create a roadmap towards better sleep. If it makes sense to both you and to us, then we'll talk about the next steps. If you're interested in getting more freedom while you're sleeping and creating a more silent bedroom, then here's what I invite you to do. Book your discovery call now. Slots do fill up, and we can only accept what's available on the calendar. I want to be clear. Our job isn't to convince you. Our job is to ensure this is right for you. Or if not, we'll help guide you to the solution that is right. With that being said, if you want to start waking up, then the decision is easy. Why am I doing this? Because we practice a unique style of care called Actually Help People First, by helping you become more aware and educated on this process. If you want help and think it's a great fit, we'd love to see you in the chair and get fitted with a custom dental device to help you sleep more restoratively. We only accept people who are truly wanting to take the right step towards help with their snoring and sleep apnea. So what is the decision you have in front of you? It isn't to work with me or not to work with me. It's not even to book a discovery call. The decision is simply this. Do you want to continue dealing with feeling constantly lethargic and fatigued, never getting enough sleep, and having it negatively affect your life and your health? Or do you want to take control of your nights and start to actually own the day? If that's what you want, here's what to do right now. Go down below the video, click the button, and schedule your discovery call now. Fill out the information so we can get a better understanding of where you're at right now, and we can talk at the time you choose. Once again, my name is Dr. Brenna McLean. We look forward to helping you get the restful and refreshing sleep you deserve.